Welcome to another enlightening conversation with On the Couch with NMC. Today on the couch, we will be exploring anxiety as one of the mental issues faced in Namibia. With that said, I'm thrilled to be joined in the studio by Zara. Welcome, Zara, to the couch.
Thank you for having me, Anthea.
Can you just tell us a little bit about yourself?
Okay, so my name is Zara Mbangtang. I'm currently doing my master's in clinical psychology at the University of Namibia. So this is my final year, and I'm doing my practicum with Uni Health.
So Zara, what is anxiety? A lot of people downplay it so much. A lot of people think it's just a word, but what is it?
So anxiety is a feeling of excessive worry or concern, often garnered towards situations we are unfamiliar with. They're unknown to us. So it's a very common experience. Everybody experiences it. Again, it's because we're dealing with things that we don't know about. So it can be as simple as having a job interview, as well as maybe going for a date with someone you don't know. This is the first time you're meeting them. Having a thought about whether you're going to pay your bills by the end of the month. So such situations, because we're not sure about what the outcome could be, generates feelings of worry, of concern, of anxiousness, and those are associated with anxiety.
So you have mentioned few symptoms and a little bit of classification of anxiety, but what other symptoms are there of anxiety? What other manifestations are there one can say of what anxiety is?
Yeah, because most people honestly often associated with worry and nervousness, but like you said, it can look like different things. So it can look like a mild stomach ache. It can look like nausea, sometimes difficulty sleeping, restlessness, excessive irritability, nervousness, excessive nervousness. And also it can also be in circumstances where if you're a person who likes to go out and then you start avoiding certain situations because you're associated with a fear or an incident. It can be an attachment to a person or a place because it feels safe. So diverting from that, it's unfamiliar, so you'd rather not. It can also be indulging in excessive drinking or drug use because you're trying to numb whatever it is that you're experiencing because you don't know what the outcome could possibly be. Yeah.
So does anxiety have any relation to any disorders?
Yes, anxiety can reach a point of a disorder. And a disorder is when it's at a very extreme state of distress and impairment to your daily functioning. So it stops you from doing things you're normally used to do. And so anxiety can include the following disorders, one being a panic disorder, another being a specific phobia, which is either to flying or heights or blood or injections, and also agoraphobia, which is where it's fear of or anxiety towards places because you're afraid you can't escape. So it could be closed or open spaces, public transportation, and also generalized anxiety disorder.
So how can these disorders or how can anxiety be treated?
There are different ways to treat anxiety, but before we can treat it, let's learn how we can cope with it.
Yes.
So a coping mechanism one can implement is exercise, any form of movement, anytime you're feeling anxious and nervous. Moving releases those feel-good hormones in our bodies, the endorphins. Also look at your diet, because sometimes if you have a poor healthy diet, it releases stress hormones, cortisol, which is known to trigger anxiety as well. And pay attention to your sleeping patterns. It's important to get enough sleep. We all know when we don't get enough sleep, we're irritable, we're forgetful, and often in situations we were once calm, we can feel a bit anxious or agitated about it. And then talking to someone, it's very cathartic, talking to someone about an experience, because in that sense, you're releasing, you're expressing yourself, and also people can validate what you're feeling so you don't feel like it's just in your head. And then when it gets to an extent where you feel, okay, maybe none of these approaches are working for you, seeking professional help is also a great way to cope with anxiety.
Is there anything such as a healthy anxiety and a bad anxiety?
Well, I would like to say there are instances where anxiety is helpful. Okay, so this is where it motivates you. Like just think of a job interview.
Yes.
You've been out of work for a while, maybe it's some promotion you want and you're interviewing for this position, so you're anxious because you want it. So you often tend to prepare, and then you'll over prepare because this is something that you feel will be beneficial for you in the future. So that's where anxiety is helpful.
Yes.
It motivates you to do better. Then when it becomes unhelpful, it's where it now becomes so distressful that impairs your daily functioning. Like now you don't feel like associating with people, or maybe you're starting to avoid things that you often were comfortable doing, like because it's triggers of fear or anxiousness towards something that happened that you haven't dealt with.
So we can go to the doctor, right? You go and have a pill or whatever. Are there any other ways that are not medical that one can use to cope anxiety with?
Yes, as I mentioned earlier, like looking at your diet, trying to change some of the stuff you're eating, also paying attention to your sleeping habits, try to get 8 hours if you can, and also relaxation techniques where meditation, if you can meditate, try practicing meditation or any form of self-care. A good friend of mine always asks me when I'm anxious about doing anything like this, for instance, okay, do something that brings you joy, because that is distracting you or actually you're getting away from the routine. Often when we do the same things all the time, we expect a specific outcome, so we're familiar with it. But then if you just throw in something different to do and just something that makes you happy, it helps you now revisit a situation and then maybe look at it from a different perspective.
So basically breaking a routine can, in some cases, help.
Yes, movement. And that's movement doesn't only necessarily mean physically getting up and running. If you're anxious about presenting to your boss, and often you're just sitting and you're ruminating about every possible thing that could go wrong, maybe just get up or make some tea or maybe take a hot bath. So self-care is very important. Yeah.
So how can one's family and friends assist someone that has anxiety? How can we be that helping hand instead of being the one that also causes the anxiety?
Okay. So one has to first vocalize what they're talking about, because family and friends don't know how to help you if they don't know what you're going through. So the first step is for the individual to say, I'm struggling with this right now, and I would like assistance. And what would that assistance look like? Because maybe to me, it would just be you listening to me. But then to you, Anthea, could be, I would actually like you to take me out or just show me something I could do more. It's more practical.
Yes.
So as the individual, one has to communicate to the family their needs. What would make them feel less anxious? Could it be possibly maybe, could we communicate better? And what does communicating better look like? Could it be maybe in terms of job stress, when you're getting anxious, could you let me know 2 days before? Could we establish that system where we're not just thrown in the deep end? There's proper dialogue that's had before something is done. So the only way for family and friends to help us or help individuals struggling with anxiety is for us as the individual struggling to communicate our need.
How does one, as a professional, help communicate that anxiety is actually really a mental issue and just not a flyby thing? Like, how would you, as a mental professional, would tell people that it's actually a very concerning issue, especially here in Namibia? We don't really take cognizance of how important that is, and we really shrug off a lot of mental issues. But how would you, as a professional, just highlight that? How can we really see that as a real issue here?
Well, having a platform like this is one great way to advocate for anxiety, because it's often internal. Individuals internalize what they're going through, and mental health is still I don't want to say it's relatively new, but it's not as spoken about highly in this country compared to Western countries. So it's just these platforms that we can do, even speaking to friends about it, advocating for it in schools, in our universities, in our workplaces, that gets the conversation going about anxiety, and not just anxiety alone, but also other symptoms that people face that they feel like they can't share because they're afraid of stigma.
Thank you so much, Zara. It has been so much enlightening and also give me a different perspective of it. Before we close, do you have any last words for our viewers?
Well, I'd like to thank you first for having me here. And I would also like to encourage viewers that are struggling with anxiety, struggling with excess worry, to the extent it's even affecting your daily functioning, to seek professional help. There are counseling facilities here in Windhoek that help individuals with such circumstances, including clinical psychology practice like Uni Health, where we also work with individuals struggling with anxiety.
Thank you so much once again. That was an enlightening conversation. I do hope we all have a little better understanding of what anxiety is and how it can really affect us. Don't forget to subscribe to our YouTube channel so you do not miss out on any of our episodes. Follow us on our social media platforms. Until next time, it's bye for now.